When you're squatting, one of the problems that can snowball and turn into a much bigger issue is when you're not addressing or correcting a lateral shift in your hips. When you're going down, this is when your hips are shifting or drifting to one side and you're not tracking straight up and down in the center of your stance anymore. This will start to make it more inefficient the way that you're moving and can lead to a lot of other issues. Some back pain, some knee pain, some ankle restriction issues. So the big thing is to understand what can you think about during your squat. Of course, you can address all the muscle imbalances, mobility restrictions, but you're still going to need to squat. And practicing the squat and knowing what kinds of cues to help you to stay centered, that is going to be key in addressing this issue. Aloha, I'm Andrew with HNL Movement. Let's dive into this topic a little deeper and let's go over what kinds of things can you think about as you're squatting to eliminate any unwanted lateral movement or this unwanted lateral hip shift. Okay, so when you're squatting, typically, especially when you're tired or you're getting fatigued, then that's when the compensations come out. What to do if you're having like a lateral shift of your hips, right? If you're kind of shifting off center line and your hips are going to one side, in this case, I'm demonstrating kind of like to the left. What are you thinking about? What are some of the cues that you want to do? Usually when you're shifting to that side, not all the time, but typically that leg is doing more work. That quad is doing more work. So it's more of a hip problem, more with hip abductors, external rotators. You want to make sure that you can use that hip to kind of push that knee out, push your hips back to center and keep that as you're going straight down and up. So essentially, I'm using this hip. If you know what it feels like to use this hip to push to the opposite side, that kind of feeling, it's really your femur's fixed and you're figuring out how to use your hip to move your pelvis on top of your stable leg. And it's that feeling that you're kind of pushing out laterally. As you're going down and up in the squat, basically both sides, hip abductors, they have to kind of create that force to cancel each other out so that you can go nice and smoothly down and up. When one side is not doing its job and the other side is doing more, that's typically when you're gonna hip shift to one side. So the cue is trying to get this motion, the feeling that you're pushing and driving that knee out, pushing the hips to the opposite side, and try to maintain that tension in your hips as you're going down and up in the squat. And the more that you can do that in your warm-up sets, the more likely you're gonna be able to keep that firing pattern when you're doing your heavier sets. So remember that, focus on the hips and keep the hips tracking straight down and up. Use your hips to cancel out that unwanted lateral shift, then improve your squat.